We'll start with the horrifying and end with pure nightmare fuel. Here are the most gruesome medical devices that were used throughout history. Number 6. The écraseur. The écraseur was a surgical instrument invented in the 19th century that was thought to be a less invasive way to remove undesired growths, such as hemorrhoids, from the body. It consisted of a small loop of chain attached to a long tightening mechanism. Doctors would loop the chain around whatever they wanted to get rid of, and then, over the course of a few days, gradually tighten it until blood flow to the growth was completely cut off. The growth would necrotize until eventually it was either manually removed or simply fell off. Remember as a kid when you would wind a string around your finger until it turned purple? Kinda like that, but instead of string, it's a metal chain. And instead of your finger, it's a painful hemorrhoid. And instead of undoing the string and watching your finger go back to normal, you leave it there until it rots off. The écraseur was very popular and widely used in the 19th and 20th centuries, and was considered a breakthrough medical advancement when compared to randomly cutting things off with a blade and hoping the patient didn't bleed to death. But for all its benefits, it definitely had some drawbacks. First off, as you can imagine, it was extremely painful. As if a hemorrhoid weren't uncomfortable already, imagine having something pinching it as hard as they could all day. The other significant drawback was the possibility of infection, since the actual removal of the growth was delayed. The écraseur would be kept wound around the growth for days until the cells underwent sufficient necrosis to fall off. The dead tissue could easily get infected if not cleaned, and given where hemorrhoids usually pop up, keeping that area extra clean was already a challenge enough. Oh, and one more thing, just to haunt you even more. Écraseurs were also used to remove tongues. Number 5. The dental key. The dental key was a tool created in the early 1700s that was used to extract diseased teeth. It was essentially a metal hook attached to a long rod with a turning handle at the end. When a patient would come in with a toothache, the dentist would position the hook over the infected tooth and try to find an angle that he could use to create the most leverage possible. Once he found an angle that he thought would work, the dentist would then use the dental key to unlock a door to hell by turning it and applying force to the tooth to loosen it from its socket. No Novocaine, no anesthesia, just straight up ripping a tooth out of a skull and all the excruciating pain that comes with that. As the dental key was rotated, it would apply leverage on the tooth and gradually loosen it from the surrounding bone. Eventually, with enough torque, the tooth would come out of the socket and the patient's toothache would be cured. The dental key was used well into the 20th century, and while it was effective at removing teeth, it unsurprisingly had more than a few drawbacks. Mainly, the excruciating pain that was inflicted on the patient when it was used before the creation of anesthesia. There were also occasions where instead of removing the entire infected tooth, the key would instead snap off just the crown of the tooth, which would have horrible outcomes for the patient, as the active infection remained in his mouth and the dentists of the time had less than adequate tools to deal with it. The dental key could also occasionally damage other teeth or the surrounding tissue, forcing the dentist to have to go back in to pull out the newly damaged tooth as well. Okay, I got that tooth that was bothering you, but I see that I accidentally nicked the one next to it. Let's just take care of that one too. Okay, I got that tooth that I nicked, but I see that I accidentally nicked the one next to that one as well, so let's just take care of that one too. Okay, I got that tooth that I nicked, but... Number 4. The tobacco enema. Tobacco was used as a medicinal plant by Native American tribes for centuries, and when it was brought back to Europe from the New World, it quickly gained widespread popularity as a new miracle drug. Through trial and error, many forms of administering this magic medicine were invented, from smoking to chewing to shoving it up where the sun doesn't shine. The tobacco smoke enema was a popular medical treatment in 17th and 18th centuries and was used to treat various conditions from headaches, respiratory failure, and colds to hernias and even abdominal cramps. In maybe its craziest use, tobacco enemas were administered to people who had recently drowned. It was believed that the stimulant effects of tobacco could help revive unconscious or unresponsive patients. Imagine seeing that on the beach. Help! Somebody! He's not responding! Quick, somebody get me a cigarette! What? Why? To calm your nerves? No, this! Early versions of the tobacco enema were nothing more than a tube that connected the patient's bum directly to the doctor's mouth. The doctor would take a drag and then literally blow smoke up someone's ass. It should go without saying, but this early version of the tobacco enema was incredibly risky for the doctor, as if he accidentally coughed and inhaled on the tube, or the patient fired one off, the bacteria from the patient's colon was instantly transmitted directly into the doctor's mouth and lungs. Eventually, someone figured out that using bellows to push the smoke into the patient's rear was far better than doctors essentially playing human centipede with their sick patients. This caused the tobacco enema to surge in popularity, until it was ultimately discovered that nicotine was not good for patients' hearts, which caused the use of tobacco as medicine to fall out of favor in the 1800s. Number 3. Artificial leeches. In medieval Europe, blood was considered to be one of the 4 humors of health, along with phlegm, black bile, and yellow bile. And medicine of the era focused mainly on balancing these humors. Any disease that caused fever or inflammation was thought to be caused by an imbalance of blood, and as a result, bleeding, or bloodletting, was thought to be the best way to rid a sick patient of their excess blood and cure them of their disease. Somewhere along the way, someone realized that leeches could be used to suck the blood out of patients in a cleaner, more natural way that didn't cause a mess like traditional bloodletting. Leeches would be collected and starved for several days to ensure they were nice and hungry. Then they would be placed on various parts of the body, and they would suck the patient's blood, taking care of the entire bloodletting procedure. All of this is well and good, but what if your leeches were full of blood and not hungry anymore, but your patient, for some baffling reason, still had polio? Well, evidently this was so much of a problem that the artificial leech was invented. The artificial leech was a small metal cylinder with numerous blades and a small vacuum pump. The blades would be inserted into the skin and rotated, cutting the patient with dozens of tiny lacerations. Then the vacuum pump would suck the blood into the tube. Now, I understand leeches are gross, but is this really any better? It's like vacuuming the life directly out of your body. Artificial leeches held numerous benefits over live leeches. First off, it wasn't a freaking leech sucking your blood. And then there was the matter of reusability. Once a leech was full, it would stop drawing blood. The artificial leech was like a robot vampire that allowed the procedure to continue until the doctor felt the patient had given up all the blood necessary to balance their humors. Or until the patient died of humor imbalance. Interestingly enough, out of all the things on this list, artificial leeches are still widely used today. They help not only with bloodletting, but also reduce inflammation in a condition called venous congestion that helps to redistribute blood during cosmetic surgeries. Even more unbelievable, real leeches are making a comeback in cosmetic surgery, replacing artificial ones as a more effective natural alternative. Which just goes to show, slapping the word natural on anything these days will make rich people want it even more. Number 2. The lithotrite. Bladder stones are hard mineral deposits that can sometimes form in the bladder when it's not regularly emptied. While they can be often passed with a fair amount of pain by simply peeing them out, sometimes these little bastards get so big that they just don't fit. And in this case, a urologist has to break the stone into smaller pieces in order to remove it. In the 1800s, this procedure was done with a horrific instrument called the lithotrite. The lithotrite was a long, slender tube with a crushing mechanism at one end. Slender being a relative term, by the way. The lithotrite was inserted into the urethra, and the surgeon carefully maneuvered it until it reached the patient's bladder. Then the doctor would open the crushing mechanism and try to find the bladder stone like those arcade crane games. Once the doctor found the stone, he would then use a dial on the other end of the lithotrite to close the claw and crush the bladder stone. The goal was to do this until the stone fragments could be passed naturally in what would probably be the worst pee in the patient's life. Now, I'm sweating just after explaining that, and my member has more or less retreated into my stomach. But did I mention that modern anesthesia was invented 23 years after the lithotrite was invented? These patients were just white-knuckling it through the whole experience. Surprisingly, the lithotrite, as horrible as it sounds, was a far better method of removing bladder stones than the one that it replaced, as it had only a 2% chance of mortality when compared to the almost 19% chance of death the previous procedure had. Thankfully, these stones can now be broken up with ultrasonic waves and will never have to face the horror of the lithotrite. Number 1. The chain osteotome. Oh, you thought that was the worst one? That's cute. Anyway, in the old days, it goes without saying that amputations were not only incredibly painful, but also ridiculously dangerous. Before the days of advanced bone saws that we have today, amputations were done with rusty handsaws, cleavers, or even a hammer and chisel. Oh yeah, and no anesthesia whatsoever. The patients felt everything. We've all seen the movies. The doctor would give you a stick to bite down on and then saw your limb right off. These early amputations sometimes did more harm than good, as bone could often splinter or split from the jagged movements of the handsaw or the clunky and incomplete chipping away of the chisel, damaging surrounding tissue and making the healing process a nightmare. People died from these early amputations all the time. So in 1830, Bernhard Heine invented a new way to saw off someone's arm, which he proclaimed to be safer and more effective. The chain osteotome consisted of a chain with sharp cutting edges, kind of like a miniature chainsaw. Okay, not kind of. This thing was actually a tiny hand-operated chainsaw. The chain was attached to a handle or a crank mechanism that allowed it to be rotated or driven in a circular motion. As the chain rotated, the sharp cutting edges would grind away the bone, creating a clean and precise cut. Now, here's the thing. The chain osteotome was in all seriousness a huge leap in medical science. It made amputations cleaner, more precise, and overall safer for everyone involved. And it paved the way for the modern bone saws we see today. That does not, however, make it any less terrifying. It's like a horror movie. Imagine hearing the sound of the geriatric doctor slowly cranking his hand-powered chainsaw he's using to slowly saw off your arm. I wouldn't even need anesthesia at that point. I'd be out cold on the table.